Tanya, can you hear me? This is Norm.
Hi, Dr. Ward. I can hear you.
Great, thank you.
Can you see the screen okay?
Good, how are you?
If we can remind everyone to mute themselves,
Yes,
and we're going to get started here.
Okay, this is Norm Ward. I'm the Chief Medical Officer at OneCare Vermont. We have a lot of excellent content here today, and so I don't want to slow us down getting into what I hope will be a good interchange of information about return to work. OneCare has had the privilege of working with Dr. Huyck in the past on the Vermont Retain project. And we are welcoming her back with a very timely presentation about return to work. Tanya, could we move ahead to, I think, Karen's CV? And if everybody could mute, please. This paragraph of Karen's CV summary is extraordinarily impressive. The number of degrees after her name is a lot, she is very, very knowledgeable, and I would not do it justice to read through, but her background and expertise is unquestioned. Obviously, with the economy, with the pandemic, and with concerns about COVID itself, the whole issue of safe return to work is of extreme interest to all of us. So, Karen, are you on the line?
I am. Thank you. Can everyone hear me okay?
Very good. So we will be offering one CME credit. There'll be the means to sign up for that, with a QR code at the end. And if I could also remind people to please mute, that would be great. These are our session objectives, but we're going to move on ahead, Tanya, and there we go. So I'm going to mute myself, and Karen, the floor is yours.
Thank you. And I think there might have been some concern that my volume was low. Does this sound okay?
We're going to need to enunciate. It's a little bit weak, but if you project, I think we'll be okay.
Okay, that sounds good. I'll talk as loudly as I can, and I will also try to follow the chat. I will try and get through this efficiently so that there's a lot of time for questions, because sometimes cases are often the best way to think about return to work. And I really appreciate the introduction and being able to be here. Most recently, I am the medical director of Vermont Retain. And Vermont Retain is a project that's funded by the U.S. Department of Labor. And I'm required to tell you that this presentation, although funded by the Department of Labor, doesn't reflect the views of the Department of Labor or endorse any endorsement of products, which there aren't any, don't reflect an endorsement by the U.S. government. So this is purely a Vermont Retain presentation. We can go to the next slide. And you can go to the next slide. I'm just going to give a little overview of what I'm going to talk about so that you can stay oriented during the talk. So I'm going to give a little background on what Vermont Retain is, and then talk about why planning for return to work is important, especially during the pandemic. More about the provider role in return to work planning and documentation, which often tends to be stressful for providers. Some easier strategies for identifying health job mismatches in relation to the pandemic, and what to do if you do identify a health job mismatch and where you can go with more
I can't
questions.
hear you. Debbie called, and she said it's like you're whispering.
Okay, sorry, I'm being told that it's very hard to hear me. So I don't know how to do that, change that. This was working when we did the check. Do you want me to continue, or do you want to take a break to try and get the volume higher?
Karen, your volume is fine for myself.
It's fine for me as well. I would continue.
I would proceed.
Okay, thank you. And then what to do if you have questions. We have a lot of resources. So we're hoping that at the end of this that you'll understand why return to work planning during the pandemic is important, how workers, employers, and providers can work together to optimize work outcomes, and some best practices for COVID and non-COVID work issues. So we can go to the next slide, and we can go to you could skip to the next slide. And the next. So just briefly about Vermont Retain. So Vermont is one of 8 states to have been awarded last year a U.S. Department of Labor Retain grant. This is a national program that originally was to help focus on keeping workers in the workforce if they experienced an illness or injury, and it has taken a role helping with COVID response, particularly as it relates to return to work and unemployment. And a point of confusion that sometimes comes up is considered to be a project that either works with workers' compensation insurers or just for people with work injuries. And the pilot program, which we are in now for Vermont Retain, is for anyone who lives and works in Vermont and is at risk of work disability, even if it's not work related and regardless of insurance level. And our focus right now really is on a lot of training about return to work. So we can go to the next slide. So the next topic is really, why is return to work important? This is the crux of the rest that will follow. So we can go to the next slide. This is a graph that shows the chance of returning to work after a work injury. This is in a non-pandemic situation. Percent chance of return is on the y-axis, and the weeks of disability out of work is on the x-axis. So you can see that with the dotted lines, a worker with an injury who's out of work for 12 weeks has about a 50% chance of ever returning to work. And that chance drops off precipitously with additional time out of work, so that at 1 year, there's less than 10 to 15% chance of people returning to work. And next slide. There's additional issues that affect people during the pandemic. So obviously a lot of us have had prolonged time out of work, but not because of a specific injury or illness, but because of the shutdown. And even this extended time out of work can result in a lot of different health issues that can interfere with return to work or put workers at risk when they re-enter the workforce. So some of the interval issues that may have occurred are not just COVID and the sequelae of COVID infection, which tends to be the focus of a lot of the discussion, but also people may have had intervening new injuries or illnesses or worsening of existing disorders that limit their ability to work. Physical deconditioning is something that has arisen for a subset of people just with difficulty getting physical exercise while sheltering at home and distancing. And that deconditioning in relation to work activities can also increase the risk of injury. Then on the mental health side, there's been a big increase in new and worsening mental health conditions, and even just stress reactions that may not reach the level of a clinical mental health diagnosis. There's risk of domestic abuse in these times of stress. We've seen a lot of increase in drug and alcohol consumption during this time, and these are all issues that may not be apparent, especially in the healthcare setting, but can pose important barriers to be able to return to work safely. And some of these can present workplace safety issues for not just the worker, but for their coworkers as well. And then we have to remember that all of these health issues are occurring in a setting of a period of reduced access to healthcare, loss of income, social isolation, as well as a lot of increased caregiver responsibilities at home. So next slide. So we also have to remember that a lot of jobs have been redesigned during the shutdown to meet reopening guidelines. And that also presents some new health and safety risks because workers are returning to their jobs potentially with less familiarity about their job tasks and workflows. And when you combine that with deconditioning or health risks, you're really increasing the health and safety issues. So beyond the effects of the pandemic and isolation, unemployment is an independent risk factor for adverse health outcomes in and of itself. So not just for the employed individual, but for their family members. And this can include both mental and physical adverse health outcomes, some of the main ones being increased risk of cardiovascular disease, cerebrovascular disease, depression, suicide, and increased substance use. And when you are thinking about returning workers back to work after a period of unemployment, it's important to know about these issues because these factors can also decrease productivity and increase risk of injury and being out of work again. Next slide. So next I want to talk about the provider role in return to work planning because this is often a role that's overlooked or one that medical providers are not comfortable addressing. Yet it's very critical in being able to prevent a lot of these health negative health outcomes. Next slide. The way I like to think about return to work is a network of clear communication between the worker, the employer, and the provider, and that some of those interactions may occur just between the worker and the provider, or the provider and the employer. Some return to work responsibilities live just with the individual, whether it's the worker, the provider, or the employer, and then there's an overlap of all three. And this is always the case for return to work, but during the pandemic, when employers are having to revise job tasks and workflows on a large scale, many workers are out of work or coming back to work at the same time, and everyone is dealing with very unfamiliar scenarios. It's even more important for providers to be thinking of themselves as a partner with the employer and the employee for optimizing work outcomes. Next slide. So I'm going to spend a little bit of time talking about best practices for return to work by role. And I think it's important for everyone involved in return to work to understand the other person's role. So I'm going to go through provider, employer, and worker best practices. But there are several best practices in the pandemic that apply to everyone. So the most important thing to remember, which we're all, I'm sure, very aware, is that information and guidelines are constantly changing. So staying informed is the first step, and using sources of information that are reliable and current is the best strategy. So the U.S. Department of Labor, the CDC, the EEOC all have great information about COVID, and I've provided embedded links. Anything you see in this talk that's green and underlined has an embedded link, and I'm happy to share these slides so that you can keep these resources on hand. And then the state resources, including the ACCD, which is really where all of the information is being collated, as well as departments of health and labor. And then, I do consider in this talk the state sites to be Vermont sites, but I also wanted to remind you to keep in mind that some patients may be working in New Hampshire, Maine, or Massachusetts and New York, and that these states have different guidelines from Vermont. So it's worth keeping that in mind as you're navigating this. Next slide. So best employer practices right now is first and foremost, employers need to be following the state reopening training and the state reopening planning requirements. I'll talk a little more about those. Because we are in the middle of a pandemic, employers are now allowed to ask if employees are experiencing COVID-related symptoms and doing temperature checks. Keep in mind this may change when we move into a post-pandemic phase, but for right now, these medical questions and tests are allowed. Outside of these COVID-specific inquiries, employers still cannot ask about workers' health unless it affects their job performance, and I'll talk about when that's the case later. All medical information collected by the employer has to be kept confidential in files separate from personnel files, and this includes the COVID screening data. And we really encourage, when we give these talks to employers, we're really encouraging them to give information to all employees, not singling out individuals or groups, and trying to create an environment where employees feel safe to voice concerns about safety and their job tasks, and not worry about stigma, harassment, discrimination, or retaliation. And then, of course, everyone needs to stay on the right side of employment law. Next slide. Best practices for employees include understanding how work is protecting their health. And so you can see that in all of these best practices, and I won't read them all out, they're fairly self-explanatory, but there is a provider role in educating patients about these best practices. In particular, letting your patient know to contact you as soon as possible if they experience an injury or illness that could affect their work, so that you can help them devise a fast treatment and work activity plan is really key. I know it's common for a lot of Stoic Vermonters not to seek treatment until symptoms have really progressed. So it's often helpful to talk in advance about encouraging patients to let you know when they think recovery doesn't seem to be headed in the right direction, especially with respect to work. And then patients have a responsibility to learn and adhere to their COVID infection control practices. And we'll talk a little more about that. And next slide. So in terms of provider specifically, I like to reassure people that you don't have to be an expert in return to work to be able to follow some return to work best practices. So one of the first best practices is just asking about work. And in this case, we're going to focus specifically on screening for COVID-specific work disability risk factors. And then keep in mind the return to work curve we just discussed and the negative health effects of unemployment, and remember that time is of the essence. It's also important to get buy-in from your patients, and workers can tell you a lot about the job tasks they find easy and difficult for them, and you can use that as the basis for planning. Also, when going back to the communication triangle, employers and patients don't have medical degrees, so communicating without medical jargon and abbreviations will go a long way. And when you get stuck, just like we're asking our patients to ask for help early in the process, you should also ask for help early in the process if you are having trouble with this, because it's not something that we're really taught how to do in our medical training. And then lastly, education is prevention. So making sure your patients know about infection control practices is important. And I want to take a moment to acknowledge that healthcare providers are workers as well, and also workers who are in the highest risk for COVID exposure. Some of us are also employers, so I just encourage you to think about this talk in the context of these different roles that you may have, not just the provider role. And that becomes especially important when talking about self-care plans. Next slide. Now I'm going to talk a little bit about the first provider best practice in that previous slide, which is how to assess for work disability risk factors. And again, we're going to stay focused to COVID. And I think of this screening as a way to identify a health job mismatch. That's really your goal, is to understand if the patient's current health status is mismatched with what they need to do at work. Next slide. So this is a set of screening questions we developed at Vermont Retain to help identify these health job mismatches specific to COVID. And it's divided into 4 types of questions. The red section has work questions. The yellow section has questions about COVID risk. And the green section has questions about work capacity. And the final section, the blue section, has questions about potential psychosocial barriers for returning to work. And those can often be quite hidden. So next slide. The next 4 slides that I'm going to go through show these questions in each section in detail. And then I'll follow that with what to do if patients screen positive for any of these risk factors. So in the red work screening questions, these will help you understand what your patient does for work, whether they're currently working, whether they have potential for COVID exposure at work, if they have identified any safety issues at work, whether they've had any work accommodations or benefits before the pandemic, which is important to know because that might need to be changed when they return to work in a slightly different job setting, and whether they have new accommodations or benefits that have come up in the intervening time. Next slide. So the yellow screening questions about COVID are very straightforward and just help you systematically understand whether your patient has had COVID, been exposed to COVID, is at high risk for COVID, and whether they live with someone who's at high risk for severe disease. Next slide. The green work capacity screening questions will help understand whether your patient feels physically, emotionally, and cognitively ready to return to work. Next slide. And the psychosocial screening questions can be used to help uncover these more hidden barriers for readiness to work, and that includes increased drug or alcohol use, increased family care responsibilities at home that could interfere with being able to work, lack of safe transportation to or from work if they do have a job, and domestic violence and other safety issues at home that may have arisen during this time of increased stress. Next slide. So next we're going to get into what you should do when this self-screening identifies a health job mismatch. And I'm going to go through some but not all of the questions in more detail. So in terms of positive employment questions, screening questions, if your patient is furloughed or unemployed, the first thing you need to do if they're out of work is determine if they have a job to return to. And if they do have a job to return to and they want to return to that job, then the key is creating a robust self-care plan until they can return to work and potentially connecting them with resources to get them through until they return to work. And again, I'll have a lot of resources at the end. And their care plan should also address any positive risk factors that come up on the rest of the readiness to work screening. If they don't have a job to return to or don't plan to return to their prior job, then you want to discuss their work goals, emphasizing the importance of work for health and encouraging them to get back into the workforce. And one of the best resources in terms of employment assistance are the Vermont Career Resource Centers. There's 12 of them throughout the region, and they are offering virtual services during the pandemic. So some of this kind of assumes someone is returning to work with a full work capacity. If they do have other barriers or don't have a full work capacity, we're going to discuss that in the green work capacity section. If a patient has contact with individuals who have or may have COVID, and again, we are encouraging people to think about interaction with others, not in their quarantine pod, to, you know, in the context of universal precautions, like we thought about it in the era of the HIV epidemic. So the first question is really whether work can be done remotely, and if it can, to support that for your patient. And all Vermont employers and workers are required to complete the state COVID training, and every employer has to have a state restart plan. And the links are embedded in this slide, so you can see what those are. This is the point that you want to make sure any worker who's going back to work, or who's not who already has returned to work, not only did the training but understands what it says, and has read and understands their employer's restart plan, and just doing some extra education around best infection control practices, so that you feel comfortable that you're returning your employee to a safe environment with as much information and knowledge as possible. I'm also, in this talk, the later bullet points are going to include employer responsibilities, so that you understand what better how to partner with the employer and the employee in successful return to work, and to be able to guide and counsel if some of these issues come up in the workplace. So one is that medical grade masks, if they're required at work, the employer must pay. If non-medical grade masks are required, the employer is not required to pay for them, but it is best practice to make sure that everyone has them. And then some very recent information is that the state passed some legislation that does allow frontline workers who are at elevated risk for COVID, as well as people who test positive for COVID within 14 days after a documented occupational or work exposure to COVID, can potentially get workers' compensation benefits for a work-related infection. So these would be frontline workers like firefighters, police, EMTs, healthcare workers like ourselves, et cetera, who are working in COVID-positive environments. This is just passed. We haven't seen how it plays out, but that coverage is potentially there. Next slide. The Vermont Restart Plan that all employers have to put together is based on a very standard hazard reduction model. This type of model is based on 4 hierarchies of control. And the first control in any hazard mitigation scenario is to remove the hazard if possible. This is the elimination step. And elimination in this context means remote work and separation from contact whenever possible. If that is not possible, then the next thing you're looking for is engineering controls, because those don't depend on human behavior. So that's things like adequate ventilation and airflow, plexiglass barriers, so you can see if these have been implemented in people's workplace. The next is administrative controls. Those are the rules that people are supposed to follow. So, you know, we're all familiar with these: social distancing, sanitizing, cleaning touch points, not congregating, not sharing tools, supplies, food. And the very last thing you want to rely on is the personal protective equipment, which is not to say it's not important, but you really want to make sure those top 3 are in place first. And the state, I came across this great PDF that the State Department of Health has put together with recommended personal protective equipment by job type. And I included a link to it, so it's a really nice reference guide. If you have a worker in a specific context, you can see what the state is recommending for them to use for personal protective equipment. Next slide. If a patient identifies that they have concerns about doing their job safely, the next steps are to ask, it's a two-part question. what obstacles are preventing them from doing their job safely, and what support do they need to help them do their job safely. And then based on that, you can provide a letter of work accommodations if needed, that gives safe and appropriate modified work consistent with a person's work capacity. And if any employee can contact VOSHA, and anyone can contact VOSHA. It's the Vermont Occupational Safety and Health Administration. If they have questions or concerns about infection control and safety at work. And there's a place on their website to report violations. The priority to violations are ones that are submitted by the worker themselves, but you can also submit anonymously. And the link for their website is here. Next slide. The last set of questions in the employment screening section relate to whether a patient already has work accommodations or is receiving benefits. This is where I think a lot of providers get a little uncomfortable or uncertain. So kind of my easy step-through process is first asking if the job tasks have changed. So if someone has an existing work accommodation, but their job task has changed because of the pandemic, you need to know that. And then you want to ask if their underlying condition has changed or worsened. And then what you want to do is update their work accommodations so that their job tasks match their capacity. And it may be that they don't need accommodations updated, but you want to check and make sure that that a mismatch hasn't developed. And you can keep in mind that you can make interim accommodations. These are particularly being emphasized by the EEOC right now during the pandemic, so that you can progress people as they go back to work to see how they're doing. And until they get there, it's often hard to tell how that accommodation is going to work. And so you can progress through. And then if they have benefits paperwork that needs to be updated, you should do that as well. And if we have more time, I can talk about how to approach work accommodations and benefits paperwork. That can really be a talk in and of itself. But at the end of the talk in the resources section, there's some steps you can take if you get stuck there. So benefits either protect job or protect wages. And so you don't want to shirk that. So if you get stuck, just ask for help. And while you're getting all this set up for safe return to work, if a mismatch has developed or you think there's chance of progressing someone, you also want to be thinking about getting them prompt treatment and diagnosis, rehabilitation, ergonomic assessments, or potentially vocational retraining to help match the job and their capacity more accurately. This is a brief description of the type of benefits that you might encounter returning people to work. And again, don't shirk these because they do provide wage replacement and job protection for people. I'm not going to go through them each individually, but there are new protections through the CARES Act and the Family First Coronavirus Relief Act for certain workers to access unemployment compensation. The Vermont Department of Labor would be the place to go to for questions about these benefits. Next slide. In terms of what to do when a patient has a COVID exposure or gets COVID, the first step is always to determine in an exposure situation if an exposure actually occurred. And Vermont has kind of a condensed algorithm for determining exposure, and then the CDC has broken that down a little bit more detail for healthcare providers, community-related exposures, and travel exposures. So I've provided those links. They're in a grid format, and you can really, they're very helpful for seeing if an exposure occurred. If an exposure did occur, then you need to follow the isolation guidelines. The state Department of Health has great guidelines, and they've just put out a new guideline called When Can Employees with COVID-19 Return to Work? Excuse me. And your job with this, in addition to making sure that isolation is followed and ending the isolation at the right time, will likely be providing a letter of medical clearance. Providing patients with resources is also helpful. And, you know, beyond the infection clearance, you also want to be thinking, are they physically, mentally, cognitively ready to return to work? So you may need to be thinking about either permanent or temporary work accommodations for those sequelae of infection. On the employer and the legal side, employers can delay an applicant's start date for a new job or withdraw the job offer entirely if the new hire has symptoms of COVID or tests positive for COVID. They also can notify coworkers that they can notify coworkers that they were exposed to a COVID positive worker, but they cannot disclose the identity of the COVID positive coworker, and they cannot require the employee to disclose their own identity. So I encourage you to look at the Department of Health resources. They have some great ones: what to do when your coworker has COVID-19, what to do if my employee tests positive for COVID-19, what to do if you're a close contact, what to do if you're a healthcare worker. And they're all PDFs on their website. Next slide. In this slide, I summarize the current Department of Health recommendations for returning someone to work after COVID. And this is in the handout they've made, what do I do if my employee tests positive for COVID-19? And you can either do, I'm sure many of you are already familiar with this, if they have symptoms, it needs to be symptom-based return to work. If they don't have symptoms, it's time-based. If they develop symptoms, switch to the time-based return. And they also give guidance about when close contacts of someone with COVID can return to work. They're very clear on the Department of Health website that a negative test for COVID nor a letter from the Vermont Department of Health is required for return to work. And again, if you get stuck in this process of not knowing where to return, how to return to work or when, these are the different hotlines and phone numbers that you can call for help, in addition to being able to call us at Vermont Retain. Next slide. This question comes up a lot. What do I do if my patient or my family member has risk factors for severe infection? First, you follow the same guidelines that we outlined for just what do you do if you're working in a setting where you could have COVID exposure. And then in addition, you might need to provide additional exposure protections for that employee. So some examples could be reassigning to a less populated work area, additional protective barriers, kind of thinking about those engineering controls, or do they need additional personal protective equipment, designated work clothes, shift changes, all of those things can be additional protections. And so we talked about an employer can delay or withdraw an offer if someone has COVID, but they cannot delay a start date or withdraw a job offer for someone who's at high risk for infection. And they also can't say that an employee can't return to work solely because they are at high risk, unless you as the medical provider determines through an individual assessment of that patient that their condition poses a direct threat to their health that can't be addressed by a reasonable accommodation at work. Next slide. This slide is a framework that is designed to help providers match work with personal infection risk factors. It's from the New England Journal of Medicine, and it's based on the OSHA guidance. So I put both of those references there for you. essentially, a person's level of risk includes the type of industry, how close do they need to be in contact with others, are those people they're in contact with likely to have COVID? And I've also added something that's gotten ignored from these lists that I've seen being published is you also have to really consider whether the employer and the worker have the ability to adhere to the infection control practices. And that, again, gets to that question, are you returning them to a safe work environment with as much knowledge as possible to protect themselves? So this I find a really handy grid. Across the top is the patient's risk for severe disease from COVID, and across the side is their occupational risk. And patients who are low risk in their work setting and low risk in their infection status can return with the usual universal protections. And then as the risks get higher into the medium and high categories, either from an infection standpoint or an exposure standpoint at work, you get into considering whether they need additional protections or should be kept out of work completely, and C is keeping them out of work completely. Next slide. If your patient doesn't feel ready to return to work, then these are the steps that we recommend following. First, really understanding what they do for work, how they do it. And again, they're really the expert in knowing what job tasks are difficult and easy for them. And then you want to address as much as you can the underlying problem to get them to a point of being physically ready. While you're working on getting them physically ready, you can provide work accommodations. Some simple ones to implement would be a gradual return to work in the setting of reconditioning or a condition that's going to get better, lighter tasks, fewer hours. If you feel like you're having difficulty assessing their safe physical demand level, physical or occupational therapy evaluation can be helpful. I recommend following up frequently as they're going through the return to work ramp up process to make sure that they're not falling out of the workforce or running into problems getting back in. And if you really determine that even with all the right treatment, rehabilitation, job accommodations, they're just not safe to work, then again, you can refer them to career resource centers and add in a recommendation to talk to the Division of Voc Rehab, which can really help them with job development, particularly for people with severe and permanent disabilities. And always, if you're taking someone out of work, you've got to connect them with their social support resources because of those negative health effects of unemployment. On the employer side, employers can't ask employees directly about a medical condition unless that condition poses a direct threat to themselves, this should sound familiar, or they're unable to perform the essential duties of the job because of their condition. Next slide, we just have a few more slides. If someone doesn't feel emotionally or mentally ready for work, you're going to follow a lot of the same recommendations as for physical unreadiness. And just really, I encourage you to ask about these and respect these concerns, assess for more serious mental health diagnoses. This can range from a stress reaction to very serious mental health conditions. You want to encourage mental health friendly work accommodations and refer for resources and reminding people that self-care is not selfish. On the employer side, employers, again, they can't ask directly about mental health conditions unless it poses a direct threat or they can't do their job. Interestingly, anxiety about COVID exposure, if it reaches the point that you as a health provider determine that they are unable to work, this could potentially be compensable under the Vermont work comp law as a work-related stress claim. Unfortunately, those claims are often hard to have covered, and engaging in that process can add additional stress. So it's definitely something that you would want to talk carefully with your patient about, but it is something that is being recognized as a potentially compensable work claim. Next slide. I included some mental health resources that I think are helpful. The Department of Health, in their coping strategies section of the COVID website, lists these tips, which can be nice tips to hand off to people. Employer assistance programs, we're lucky to have Invest EAP as our state employer assistance program, has a lot of resources, and if your patient is at an employment site that has access to these services, encourage them to use them. The CDC has some COVID-specific stress resources. The Department of Mental Health has a hotline for suicide and services and peer support. So you probably want to keep those handy for patients. The Department of Health also has in their resource coping section some really excellent videos and resources from Mass General and other places that specifically relate to stress for healthcare providers that I encourage you to look at. If next slide, if a patient has been using more substances, you really follow the same recommendations as for physical and emotional readiness, and also getting some more details about their substance use patterns and referring to substance use resources. And this is the Vermont Help Link, which the Department of Health has put together. And again, this should sound really familiar by now. Employers can't ask employees directly about their substance use unless it poses a direct threat or it causes them to be able to not be able to perform the essential duties of their jobs. Next slide. And lastly, in the psychosocial screening, the last few questions relate to care responsibilities, transportation, feeling unsafe. These are some of the hidden barriers. My recommendation is identify them, respond with resources, and complete benefits paperwork to help people protect their job and wages. These three websites have excellent resources across the range of food, transportation, other benefits, and as well as your own experience with the local resources that you can connect people with. So if you have, next, you can flip through the next two slides. If you need more information, so we can provide this health job mismatch screener to you if it's helpful. We're working on and should have available shortly a healthcare provider checklist that goes with the screener that reflects a lot of this information. I'm a board certified occupational medicine physician. We have a few more working with us. So you can always, if you're stuck in the moment or have an ad hoc question, you can just call us. We're available as a state resource. And we can also hook you up with other information or resources. And we're going to be putting some online training modules related to some of these other tricky return to work topics soon. And you can also email me directly or our general email inbox. And our last slide is a set of resources for you for COVID-related information, particularly as it relates to work. Questions?
Karen, this is Norm. We're sorry to have stressed your voice so much, but you did a great job. And we're hoping for some questions in the chat box.
So someone has written that UVMMC employees have access to EAP services and they've provided the email address. EAP is a really great resource because it's confidential, away, outside of the employer, and they're often very cognizant of the return to work factors. So that is really a great first step for employees that have access to those services.
Karen, can you see the questions coming
There's a
through?
lot of questions coming in. So the last one that I see is, will we have access to these slides? And that's the easiest to answer. Yes, I'm happy to provide them. And yeah, so starting with, if people must miss work due to COVID testing, do they have to use personal sick time? That's going to depend on whether they're having to do COVID testing because of an exposure at work or a personal exposure. So that would be the first question I would ask. If it's because of a work exposure, that should be covered under workers' compensation. In terms of a set of guidelines for certain jobs, depending on their risk category, the CDC does have some guidelines for specific jobs, as does OSHA, and I'm happy to send those to you. And the state does have, and I embedded it in that risk hierarchy slide, they do have recommended PPE depending on job category, and I can send that out separately as well. Okay, concerns for teachers in terms of return to school. That is very, that's a tricky question. I would follow the steps that I recommended for if someone identifies a safety concern with their job. You know, I think there's going to be a lot of variability in the safety plans that schools put together, the HVAC systems that schools have, and kind of the culture of safety at a school. So I would address that really individually based on what are your particular safety concerns and try to address them. And you may reach a conclusion from that process that it wouldn't be a safe environment for them to return to. And you know, if you have a specific question for a teacher, we're happy to work through that with you. Yes, so I think I'm worried that I'm missing some questions, but the next question is about the HAN, the recent health action communication from the Department of Health that COVID transmission is minimal after 10 days for mild to moderate illness. That is what they have put into their return to work guidelines, that someone returned to work 10 days, and I think I had a slide on that. I didn't go through it in detail, but they can return to work after, this is the symptom-based approach, 10 days after fever ends and, or 3 days after fever ends and other symptoms have improved, or 10 days after symptom onset. And that is, that HAN is really nice, and I recommend that people read it. It's very usable. What about non-essential workers returning when openings are available? I do music bedside as a certified music practitioner. Great, yeah, so this should be addressed in the employer's reopening plan. And I would check with them specifically about what their plan includes for non-essential workers. Does that answer questions that people had? I'm happy for anyone to email me or call me if you want to talk about any of these further. BMI greater than 30 is considered high risk for complications per the CDC. Unfortunately, that is a lot of teachers who are asking for recommendations. Feels like schools should have a standard plan for high-risk patients so that each teacher does not have to reach out to their provider. I think that's a really good point, and I would say that I really like the New England Journal grid that was published as a guideline to help guide providers in the absence of standard recommendations. And I encourage using that in communication with the patient because everyone has very different risk perceptions and risk tolerance. And as long as the decision is being made with an understanding of the risks and the patient is willing to take those risks, again, employers cannot say a patient can't return if they are high risk, unless the provider says that that would pose, an unacceptable safety risk to the patient. So there is a lot of subjectivity in that conversation. I think the person who is asking about essential, non-essential working, so bedside as a certified music practitioner, the employer, the discussion was with the employer, but they were looking for suggestions. So I would really encourage you to go through the safety plan and make sure our administrative engineering and PPE controls in place. If all of those are in place and you have the appropriate PPE and are using it, and your provider doesn't feel that it would pose a safety risk for you, then I think you could put together a plan that would protect you. I mean, certainly people are working around people with COVID risk safely without getting it. So I think maybe use those resources in the discussion with your employer. And again, feel free to contact me for a more in-depth discussion, or maybe getting, kind of some language around any of these issues.
Karen, this is Norm. I just want to thank you very much again for a superb presentation, and we will be sending the slide deck to all of the attendees today. Tanya will send those out. And I want to point out that, as I discovered, when the slide deck is in slideshow presentation modes, the hyperlinks actually are active, but they didn't seem to be active when the PowerPoint was just in its sort of review mode. I don't know whether that's a common thing that people discover, but I discovered that today. So if you have it in slide mode, all of these wonderful hyperlinks take you right to the health department websites and all the other links that Karen has provided.
And my one caveat with these links is just remember that things might update, and so just try to make sure that you're getting current information. We'll try and update as it happens, but make sure that you're updating. Making sure that you're keeping on top of the updates as well.
Right. And Tanya has provided the QR code here. If you have a function on your smartphone or whatever, you can take a picture of this. Otherwise, there's a way to sign into the UVM CME site with the link that's provided there as well. So it's 1 o'clock. Thank you all for joining. I think we had about 60 people on the phone today, and the topic was certainly very, very timely. So thank you, Karen, very, very much.
Thank you, everybody. And definitely, I love questions, so don't hesitate to reach out.